So in this video, I wanted to go over the different osteoporosis medications that we have and to go over how they work. So what I usually tell my patients in clinic is that when someone develops osteoporosis, what happens is that the amount of bone being removed is more than the amount of bone being formed. So bone removal happens by the osteoclasts, and we have medications that suppresses the amount of bone being removed. We also have medications that can stimulate bone formation. So I wanted to make that kind of distinction during this educational video. So most of the medications that we have for treatment of osteoporosis work by suppressing the amount of bone being removed. So that class of medication is called anti-resorptive agents. So that would include medications like bisphosphonates, which are alendronate, or known as Fosamax, residronate or Actinel, or the infusion of zoledronic acid reclassed. Denosumab, which is Prolia, is also an anti-resorptive agent, which decreases the amount of bone being removed, as well as estrogen, romosozumab, calcitonin, and serum estrogen-like medications. As you can see here, you can find romosozumab on both sections. So romosozumab is both an anti-resorptive agent as well as an osteo-anabolic agent, and it stimulates bone formation. Other agents that we have that stimulate bone formation are teriparatide and abaloparatide, which are medications that are given as a daily injection. So it's very important to know that even though certain medications, they decrease the amount of bone being removed, they do so, they suppress the amount of bone being removed more so than the amount of bone being formed. And so in relation, you can have more bone formation compared to the amount of bone being removed. So in agents that are considered as anti-resorptive agents, we expect those medications to either maintain your bone mineral density, or you might have a slight improvement in your bone mineral density. The hope is with medications that are stimulating bone formation, the osteo-anabolics, like teriparatide, abaloparatide, and romosozumab, those medications help to stimulate bone formation